Good afternoon, everyone. Today, we celebrate another great and hopeful day in our battle against COVID-19. It was just 1 week ago that we received our first shipments of vaccines here in the Commonwealth. It was just 6 days ago that we started vaccinating our frontline healthcare workers. Now, Walgreens, one of our core corporate partners in protecting Kentuckians' health, is beginning to administer the life-saving Pfizer-BioNTech vaccine to what is by far the most vulnerable population that COVID preys upon here in the Commonwealth, our residents in long-term care and the hardworking staff that works to protect them. The immediate goal is helping these facilities and Kentucky by reducing COVID-19 deaths. Over 2/3 of deaths here in Kentucky due to the coronavirus come from long-term care facilities. So these vaccinations have the real potential to deal the coronavirus a significant blow and to lessen the loss that we have all lived through here in the Commonwealth, and to do so in just a couple of months. This action, prioritizing our long-term care residents and the staff, will save lives beginning today. Our long-term care residents also require the most care when they have to go to the hospital. So vaccinating them early will also increase our healthcare capacity so that others who show up to the hospital, whether it's with COVID or having a heart attack or even a stroke, can get the care they need. And we have the capacity in terms of beds and medical professionals to take care of them. Every week we do not vaccinate our long-term care residents, we lose them. But with vaccines, we can provide so much better protection to these individuals. And we've taken aggressive steps since March the 6th, when our first case of coronavirus was reported, to fight back against this virus, to not surrender and accept the casualties, but to push back to protect our Kentucky neighbors and friends and family. This is a great day for long-term care residents, and it is yet another day that we march towards victory in our battle against COVID-19. We only have to look at one facility, Thompson Hood Veterans Center in Wilmore, to see the devastation that this virus can cause in a long-term care facility. The dedicated staff kept COVID out for months upon months, not one case. But once this evil virus overwhelmed the defenses and entered the facility, it wreaked havoc on the residents, our heroes who had sacrificed so much for their country. After keeping COVID out for most of the year, we've now lost 34 residents in this one facility in the last 2 months. It is heartbreaking. And it shows how ruthless this virus is and why it is so important that these vaccinations occur early in long-term care. And tomorrow, thankfully, vaccinations will begin at that facility, and we will have more information to share about them. Protecting our seniors has been a priority since the beginning of this pandemic. We limited visitations to facilities, which was necessary, with more than 13,000 long-term care residents and 9,500 staff testing positive at more than 400 facilities since the beginning of this pandemic in March. There have been more than 1,600 deaths in our long-term care facilities. We have to do all we can to protect our most vulnerable. Along with monitoring those who entered the facilities, we've taken decisive action to help long-term care facilities themselves. We partnered with Norton Healthcare to establish a 24/7 call center access for long-term care facilities, connecting with resources at the Kentucky Department for Public Health. Trayton Oaks in Louisville was the first to rely on this assistance, and the state helped to relocate residents as the COVID numbers spiked in that facility. As we partnered with local communities and healthcare leaders to fight this virus, we distributed $1.6 billion in federal Coronavirus Aid, Relief, and Economic Security Act funding. Among others, This funding provided more than $1 billion to state, city, and county governments and local health departments for first responders, PPE, sanitizing, testing, telework, and $114 million for long-term care facilities, nurse strike teams, and testing. The Kentucky Department for Public Health mobilized strike teams to hard-hit facilities, and the Kentucky National Guard also mobilized 10 non-clinical support teams to support the state's response. We issued guidance to protect residents, including limiting visitors, which I know is hard, and we recommended residents leave a facility only when medically necessary and for needs that cannot be met on site or through telehealth. We worked with our cabinet for Health and Family Services to form a cross-functional advisory task force represented by so many different professionals in this field, several of whom are nationally known, to provide guidance to our long-term care facilities. We also adopted an aggressive testing approach. Long-term care facilities are following guidance issued by the Advisory Committee on Immunization Practices, which advises the U.S. Centers for Disease Control and Prevention. Of Kentucky's initial allotment of the Pfizer vaccine, more than 25,000 doses are going to Walgreens and CVS, which have a federal contract to ultimately help us vaccinate all of our long-term care residents and staff. The booster doses for each of the doses given here in the initial amounts will follow in about 3 weeks. My administration's goal, and the goal of Walgreens and CVS, is to have all our residents in long-term care and the staff vaccinated by the beginning of March. When more Kentuckians are vaccinated, we can visit our loved ones more often. We are all ready for those visits that we know we miss so much and have an impact on the mental and emotional health of both those inside the facilities and those who are visiting and missing their loved ones. The facilities, these vaccines are game changers. We are going to defeat COVID-19, but unfortunately, it doesn't mean the sacrifices we've had to make in today, or that we can let our guard down. Distributing these vaccines is going to take time. And whether it's by the end of spring or the end of summer, that everybody who wants a vaccine can get a vaccine. We know we've got to continue to wear masks and social distance, take extra care with those over 65 or with heart, lung, or kidney disease, that we could still lose so many Kentuckians between now and the full deployment of the vaccination, and every one of those losses would be avoidable. Please limit your gatherings, limit travel, even in and around Christmas. I want to thank our public and private partners who are doing so much to limit the spread and protect the most vulnerable. Thanks to our partners at UPS who are making sure those precious packages are getting to our healthcare facilities. Thank you to our healthcare workers who are working around the clock, fighting this virus, saving lives, and right now they're getting a little shot of hope in the form of this vaccine. These heroes have gone into hospitals and long-term care facilities day after day, exposing themselves to this virus to protect others. Now, to show a little light at the end of the tunnel, Signature Healthcare at Summerfield Rehab and Wellness Center has sent some photos and pictures of vaccinations at 2 of our Kentucky facilities. The first one is this is Joe Schroer of Summerfield in Louisville. He is believed to be the first to receive the vaccine today. We got to like his Santa hat. The next is Dr. Leon Butler, Sunrise Manor Medical Director in Hodgenville. The next is Stephen Dirk Patrick, resident at Jefferson Manor in Louisville. Oh, we got the cats and the cards out today. And the next is Janet Schoaf, resident at Jefferson Manor in Louisville. Wow. We also have photos from CVS at Homestead Post Acute Care in Lexington. The first pick is Mary Lane. These are incredible. I mean, since March the 6th, these are the days we've been waiting for. These pictures are incredible. These are the residents, the people that we've been worried so much about during this pandemic. And look at this. Talk about hope. The second pic is Mary Sykes. The third pic is Susan Arnold. There's Susan, right next to the Christmas tree. These vaccines are a Christmas miracle. That is a perfect picture. And the fourth picture is Annette Dentz. She has been at Homestead Post-Acute over 40 years and has worked as a CNA, restorative aide, and most recently, activities directors. Thank you to her for fighting so hard every day over these past 9+ months to keep residents safe. And there's a long way to go, but I hope this helps lift her spirits and those within the facility to know that victory, it's coming. We still got to work hard, but it's coming. This is the beginning of the end for this virus. And these vaccines will save lives, especially in long-term care. I now want to hand this over to Walgreens Regional Healthcare Director, Gene Hoover. Thank you to Gene's and to Walgreens and to CVS. All of us working together are going to save so many lives as we defeat the coronavirus. Gene.
Thank you, Governor Beshear. We are honored and excited to be a part of the immunization effort and supporting you and the CDC across the Commonwealth. It's an exciting time, as you mentioned earlier, the beginning of the end of the COVID-19 pandemic. This morning at 5:59, as you mentioned, we provided our first COVID-19 immunization, and our teams are swelling with pride with regards to the opportunity to do that outreach and really make a difference in the lives of the individuals across the Commonwealth, specifically those in long-term care facilities and the staff members that work there as well. All sites are not new to the Walgreens Company. Over the last 5 years, we've provided 150,000 immunization off-sites nationwide. And over the last 10 years, we've immunized we provided over 70 million immunizations. So again, very, very excited about the capability of our team and the ability to protect the communities we serve, as all pharmacists are. In the coming months, we'll provide outreach to over 35,000 long-term care facilities nationwide, and hopefully provide over 3 million COVID-19 immunizations to the individuals that are residents there and the staff. I do want to reiterate that in our stores today, we do not have COVID-19 vaccinations for the general population. As Governor Beshear mentioned earlier, that will be coming in the future months. And we'll be very, very excited to begin that process of immunizing individuals in the communities we serve nationwide. So in closing, I do want to thank Governor Beshear for his partnership, our excitement around partnering with the CDC, and look forward to continuing the beginning of the end, as you mentioned, of the COVID-19 pandemic. So Governor, back to you.
Thank you, Gene, and for Walgreens and CVS, thank you so much. Your experience in this is invaluable. Your ability to handle the Pfizer vaccine and the extra steps and process you have to go through with the deep refrigeration. You've been a great benefit to the Commonwealth. What most people don't know is originally there was planning and even contracting with the federal government for a 2-week ramp-up time. They cut that in half. And today we are seeing those vaccinations occurring earlier than we had originally anticipated. So again, to both of them, they are both our partners, Walgreens here with us today and CVS. You're doing a great job. We want to do this as fast as we can, but we want to make sure that we get to every single one of these facilities, and I know we will. Next is the president and CEO of Leading Age Kentucky, Timothy Vino.
Thank you, Governor. Indeed, it is a great day in the Commonwealth, or I should say another great day. After 9 grueling months, I cannot think of a better Christmas gift for our residents, staff, and families of Kentucky's long-term care facilities than the delivery of the COVID vaccine. As you said, Governor, the beginning of the end is in sight, and we are thrilled that the first vaccines will begin today for our residents and our incredibly hardworking staff. I also would be remiss to not say how much we appreciate the $114 million in CARES Act investment. It made a huge difference in reducing illness, misery, and deaths in our Kentucky long-term care facilities. This critical financial support, as you said, launched the robust state-supported COVID-19 testing program, which I believe to be one of the more robust state-sponsored programs in the country. It also, as you said, established the COVID-19 clinical support hotline maintained by Norton Healthcare. It allowed for the deployment of clinical support teams and mobilization of the National Guard. All of these have been a big help. We are grateful for this ongoing support, grateful to you, Governor, grateful to Cabinet for Health and Family Services Secretary Eric Friedlander for their collaboration and the tireless work of the entire team at CHFS. We believe that those services protected our residents and our staff and their families. Thank you very much.
Thank you to Timothy Vino. We know how hard you've worked and how hard it has been to watch the devastation of this virus. But I know today we all feel such renewed hope and such renewed optimism and the knowledge that we're going to win. We just got to protect each other as we move through the months that it takes to deploy this vaccine. Next, the Executive Director of the Episcopal Church Home in Louisville, Beverly Edwards.
Well, thank you, Governor Beshear. During the first 8 months of the pandemic, none of our residents at Episcopal Church Home tested positive for the coronavirus. However, as the virus spread more rapidly throughout the broader community, over the past month, I have witnessed the impact that this horrible virus has had on our residents and our staff, and it is simply heartbreaking. For this reason, I am grateful that our residents and staff will be among the first individuals within our community to be inoculated for the coronavirus. Personally, I am excited to receive the vaccination, and I encourage everyone to take it to help our elders. Everyone has individuals within their lives that mean the world to them. On Wednesday, I will take the vaccination for those that mean the world to me, my residents, my staff, family, and friends. Thank you again, Governor, for all you're doing to protect our residents. We sincerely appreciate your efforts. Back to you, Governor.
Thank you, Beverly, for working hard every single day to protect your residents and their families. Finally, we've got Secretary for the Cabinet for Health and Family Services. He's a guy that has been working with me side by side in our battle against this every single day, and who around this time of year can also serve as our Santa Claus lookalike, Secretary Eric Friedlander.
I think I should say ho, ho, ho to that, Governor. Thank you, Governor. Thank you, Gene. Thank you, Tim. Thank you, Beverly. And thank you, Team Kentucky and Team CHFS. This is a great day. This is a great day not only for Kentucky, but as we have seen, this is a great day in the world and in the nation as this virus really has attacked those people, those healthcare workers in long-term care. And as the governor said, what we our goal has been, and what it has always been, is to save lives. So, as I said, this has been a great day for the workers who have, in the face of uncertainty, continued to act heroically in our long-term care facilities. Thank you. You have made a tremendous difference. And I'm so glad that today we're going to be able to say thank you back with a vaccine. This is also a great day for our residents, who we can now begin to protect against this disease. It's also a great day for our families, because we can begin to see the light at the end of the tunnel. This is the beginning of the end of our fight against COVID. And as the governor said, getting the vaccine this quickly is nothing short of a scientific miracle. We didn't know about this disease maybe even a year ago, and to have a vaccine now that we are already deploying is tremendous news for all of us. However, science and a scientific miracle, we need to continue to be led by science. We have to follow science and keep ourselves socially distanced. We still have to wash our hands. We still have to wear a mask. We still have to limit our travel and our get-togethers and our gatherings. We can't quit the race just because we can see the finish line. So, this has and continues to be a challenge for our collective will, our patience, our perseverance. We need to continue the race. And we must continue to take care of each other. I hope if there's one thing that we learn from this COVID challenge and the challenges that we face together in the long-term care facilities, it proves this. Whatever happens to one of us in our communities and one of us in our state really does happen to us all, really does impact us all. So we have to take care of each other, particularly through these times, holidays and celebrations. Christmas, I've got a bow back there, and ho, 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 Governor. And it is ho, ho, ho of happiness, because we now have something that we can deploy against COVID and win. Governor, I turn it back over to you.
Well, thank you, Secretary Friedlander, for your leadership through this crisis, from everything from working with long-term care facilities to making sure our kids get enough to eat through the pandemic EBT program. You've led with courage, but also with empathy, and we're better off having had your leadership. All right, we'll move to questions. We will start with Tom Latek from Kentucky Today.
Good afternoon, Governor. Heard some differing amounts of how many doses we are going to get. I understand the second batch is going to be less than the first. What was the original plan, and how do things stand now, number-wise?
So we are still waiting for some clarification from the federal government. What you read is about all that we have seen. So our first Pfizer shipment was between 36 and 38,000 doses, I believe, and we have received all that. By receiving it, we either pushed it to CVS and Walgreens, and it goes to them for their program, or it arrived at those 11 initial facilities that have then begun vaccinating frontline healthcare workers. The shipments that are being received actually today, and some even before today, of Moderna are the full amount that we had announced there, and that's in the 70,000s, and we'll talk about the number of locations for that tonight. What I believe Tom's referring to is the second shipment of Pfizer, which is supposed to come this week, which is less than what we were originally told by the federal government. It's hard to know right now the reasons why. It appears that there is some discrepancy with understanding FDA rules about when you can ship it out or not. What I know is we're only getting 20, I want to say it was about 26,000 doses in the second round of Pfizer, when we believed it was going to be significantly more. But we have already made changes in numbers and how we allocate out the Pfizer and the Moderna to keep our long-term care program on track. We're going to make sure that that program stays on track to get everybody vaccinated by the end of February, 1st of March. Karen Czar from WUKY.
Hello, Governor, and thank you. I know it's early on, but what seems to be the percentage of those living and working in long-term care seem to be receptive to taking the vaccine? And what challenges do you see lie ahead to reach that March goal? Thank you.
Well, Karen, we don't have the statistics back yet because it's just today that we've started. I can tell you that I believe as of now or earlier today, we vaccinated about 7,319 individuals in Kentucky. Most of those are hospital workers. At least from initial indications, the vast majority of long-term care residents want the vaccine. We have not heard of any facilities where a significant portion are saying no to it. And if you look at the mortality rate amongst those in long-term care when they contract it, you could understand why, especially even if it's just a balancing of should I or should I not take it. By far, the weight of that decision for long-term care is that you absolutely should. We'll see if we've got some numbers back, but my understanding is an overwhelming majority of long-term care residents and staff wanting the vaccine. Ryan Van Velzer from WFPL.
Thank you, Governor. I'm curious who the group that's next in line to receive the vaccine after long-term care and hospital workers. I also want to follow up on Tom's question. I'm a little confused now about the total number of vaccines that you expect to come to the state over the next month.
We can talk about the total number we expect to come over the month. I don't have all those numbers in front of me, but we expect 2 shipments of Pfizer and 2 shipments of Moderna. I expect it to exceed about 150,000 doses. It's just the second Pfizer shipment was, I want to say about 2/3. And I'm estimating of what we initially expected. And we all want to get these vaccines deployed as soon as possible. And then the first part of the question, will you repeat, please, Ryan?
Yes, just
I
what's
got it.
the
It was
next
priority, right? Go ahead. Okay. So the ACIP group that is part of the CDC that's making these recommendations that for us to look at about who goes after healthcare workers and long-term care just came back with recommendations yesterday, and their recommendation was almost you can go in 2 paths because their next suggestion is just huge. The number of people who would fall into it. So we are reviewing that right now. What I can say is in Kentucky, our mortality rates are more attached to age than in many other states, meaning we're doing a better job of keeping younger Kentuckians alive. But if we're going to prioritize the vaccine to save lives, certainly we have to be looking at age as we go. I've committed to getting to educators as quickly as we can for purposes of schools being open and being able to, at least over time, allow for more and more capacity to get back to a more normal educational experience. But we're reviewing that right now. We were having conversations on it today, and we hope by probably early next week to have at least our initial impressions of that next group. Now, we will not be through hospital workers, frontline healthcare workers, because EMS is included in what we're doing right now, and long-term care. until and have additional vaccines for other groups probably until mid-January. And that's our hope and our expectation. It may be a little optimistic, but I think that we will hit that. Phil Pendleton from WKYT.
Thank you, Governor. How is it determined which long-term care facilities are chosen to receive the vaccine, say today or tomorrow? Because I spoke with one in Lexington. They're not going to have theirs until next week and administer them on Wednesday. So how is it decided which ones are selected first?
So we provide some input, but that's ultimately selected by Walgreens and CVS, who have the federal contract for administering these vaccines. They can be determined on a lot of factors. Certainly, what we provide a lot of input in are the most acute. In other words, the facilities where people oftentimes need the most help and might be the most vulnerable. But here's the thing: it's going to take us until the beginning of March to get through all of these facilities. So think that we will primarily start with, say, nursing homes, and then we will eventually get to assisted living. But it's the hard part, Phil, and for everybody else is the patience, is the why is this facility getting it today and us not until next week. But I guarantee you there's another facility that may be a week to 2 weeks behind that. And this is going to be our challenge until we get the vaccine out for everybody who wants it. But I will say for that other facility, having a date certain that it's coming, while not today, and we want it to be today, I hope is exciting and redoubles everybody's willingness to work to keep people safe up until that time. Kelly Dean from WBKO 13 News.
Hello, Governor. How do you see visitation changing at these long-term care facilities? You know, if you have residents that are vaccinated, would their family members have to be vaccinated in order to visit? And what do you see the timeline for doors opening back up looking like?
So we're working on that as we speak. Certainly, we got to get both doses administered before we loosen restrictions. And so that is with Pfizer, 3-week period between the first dose and the second. If an entire facility is vaccinated, our hope, and again, we're working through this, is we'll be able to allow for more visitation. It doesn't mean that everything all at once, but certainly the facility is better protected at that point. We will have to continue to look at community spread and the level of it for amounts of visitation, but there's no question that more visitation is coming. And once a facility has fully vaccinated, we can start looking at loosening those requirements or those restrictions. All right, Katie, if I mispronounce your last name, I apologize. Katie Tursick from 14 News in Evansville.
You nailed it. Thank you. It happens. Some people mispronounce it, and I'm like, don't worry about it. But so I know someone kind of already asked this question, basically saying, you know, how are these long-term care facilities? When will they be informed about when they get the vaccine and kind of who gets prioritized? But as far as where we are, we're here in the tri-state, so we cover Owensboro, Henderson, Madisonville, and a slew of the facilities that I have talked to kind of have been like, we either have gotten a letter or we haven't. So is there anything that you could maybe be more specific on as to how these facilities are getting informed, or maybe when a place like the Owensboro centers or the Henderson centers will receive their vaccines?
Do we have Jean from Walgreens still on? Oh, I think we lost Jean from Walgreens. Let us get a response on exactly how they're reaching out. That happens between either Walgreens or CVS, and the time and the method that they get contacted may depend on which one that it is. And also the timing definitely depends on the level of care that they're providing. So if it's an assisted living facility, they ought to expect to be a little bit later. But for those in the nursing home setting, they ought to be hearing here in the next couple days or week. My hope is at most about when their schedule will be. Jack Bramer from the Lexington Herald Leader. Let's go to Secretary Friedlander, who's got a little bit more on that last question.
Yes, I've been typing as we respond. Yeah, CVS and Walgreens are the folks that will reach out. We think most facilities or all facilities will know within the next week or two. And as they get vaccinated, those facilities, there are some facilities that have different levels of care all under one roof. They all should be vaccinated at the same time. So those folks that have people in other levels of care, if they're in a facility with a skilled nursing level, they will also get vaccinated, or should also get vaccinated on their same day. There may be some exceptions to that as we move forward, but that's how we're planning moving forward. And CVS really and Walgreens, they really work on the criteria. We work with them, but they're the ones that are in charge of that distribution. It is in their bailiwick to do that.
Jack Bramer from the Herald Leader. Are you there, Jack?
Yes, I was asking, what is the state's nursing home population? How many folks are we talking about?
Let's go to Secretary Friedlander.
In skilled nursing, that level is roughly 20,000. We think there are another 5,000 or so in assisted living and personal care. That can change over time with new admissions and new discharges, but that's roughly the number, Jack.
Secretary, I think that the sound only came on when you were about a halfway through your answer. Could you do it again for us?
Sure.
Numbers in long-term care.
Yes.
I think you're actually on.
Am I on?
You're on right now.
Oh, excellent. Well, so the sound didn't come on at first, and then I was here. And all right. So about 20,000 in long-term care, skilled nursing facility, and then about another 5,000 or so for assisted living and personal care. So those are approximate numbers. They change based on admission and discharge.
Okay. Sarah Ladd from the Courier-Journal.
Thank you, Governor. You were talking in the very beginning about how, the vaccine, obviously we're looking at some relief on deaths in the state as they've been a huge chunk of our losses in the state. And I'm curious, when might we see those numbers start to decrease? Will it be sooner rather than later, or are we looking at March after the booster has come through? Thank you.
Well, we believe that the first dose provides at least some level of protection. And so the moment we have somebody, even with their first dose, we have given them a better chance of battling this virus if they contract it. The challenge in when do we see changes to the numbers are that deaths trail cases by at least several weeks. So if we are working fast here over the next couple months, we ought to be able to see it, maybe a month from now. But the hard part is going to be comparing what we have versus what we would have had. In other words, the number of deaths we see versus the number of deaths that we would have seen, because the virus is so prevalent right now. Even though I believe we have at least plateaued where we are in fighting this virus, our number of cases are so high right now. There's so much infection that even though we're not seeing that exponential growth, we're still going to see more deaths every day that we're having 3,000 cases. But today, I think today they're going to vaccinate at least 5 facilities across the Commonwealth. Today, there is somebody who has received this vaccine, who's going to make it through this pandemic that otherwise wouldn't have. I mean, today is one of the first days where we know a vaccine is going into a long-term care resident that's going to save their life. We'll never know which person that it was, but we know based on the levels of infection and and the loss that we've seen, that today is a day that life is being saved. Piper Hudspeth Blackburn from the Associated Press.
Thanks, Governor. I just want to clarify, do you anticipate having to make these vaccinations mandatory, specifically in long-term care facilities for both workers and residents? And are there any specific plans on the books to assist vaccinations in long-term care facilities and more, and I guess the more rural parts of the state? Is there any sort of plans that are specific to those areas?
So CVS and Walgreens, under that federal contract, are reaching out and creating partnerships where needed, where they don't have the coverage across Kentucky. Now they're mobile, right? So they're not having people come to their store; they're going to the facility. So in places that they don't have a great presence, they're either planning travel or partnerships to get there. The vaccine will not be mandatory, at least not through any order coming out of the governor's office. But I tell you, we talk a lot about vaccine hesitancy, and it's something that we need to. We need to make sure that we build confidence in it. But I'm seeing the opposite. I'm getting about 50 letters a day or 50 letters a week at the moment, and we're seeing them pick up right now about different folks wanting to be in the highest priority, whether that's a profession or as an essential worker. And I get it. 94 or 95% effective is a game changer for these vaccines. So some who would have said if it's 50 or 60% like the flu vaccine, I might not get it, now want it. Jose Neil Donis from Aldea in Americana. Do we have Jose? All right, we'll come back. Al Cross.
Nope.
Okay. Jonathan Gregg from Spectrum.
Governor, hi, can you hear me?
I can.
Governor, could you tell us up to this date, 7,000 or so vaccinations have gone out, mostly frontline workers now that you're vaccinating long-term care facilities. What's the specific number? 5 facilities today. What is that number being vaccinated today in the LTS?
I don't have the number of total individuals being vaccinated today. We'll get that to you. What we know is we have 23,475 doses shipped to Kentucky overall. 7,319 individuals have been vaccinated. 16,156 are waiting to be administered, and that number has changed actually since this was yesterday, with Moderna coming in today. We'll get you the number of total vaccinations we anticipate today. This is really going to pick up. So we've been vaccinating individuals since Tuesday in long-term care. I'm sorry, we've been vaccinating people since last Tuesday in our acute care hospitals. And if not today, by tomorrow, every acute care hospital in Kentucky will have vaccines for their frontline workers. So we'll see that number pick up pretty rapidly. But then we will see the long-term care number pick up very, very quickly as Walgreens and CVS moves throughout the state. Denny Kemper from WLKY.
Hi, Governor. Can you speak to how the data sharing is happening between CVS and Walgreens as they start vaccinating people, how they're reporting those numbers back to the state, and how you guys are tracking those? Basically, how are you all keeping an eye on how many vaccines are being administered and who they're going to?
It's a good question. Let's get Secretary Friedlander, who's working with them.
So the way CVS and Walgreens report to us is through our health information exchange. They are able to use that. We've signed up all the laboratories. It's how we're getting information from a lot of our providers. That's how it's coming back into us. It's through that portal.
All right. And do we have either Jose from Aldea or Al Cross?
I'm here.
Oh,
thank you,
great.
Governor.
Go ahead.
Okay. About essential workers, for example, those who work in meat factories and farms and all the food industry, many of those are immigrants. Is there going to be any priority on these workers when it comes to the mass vaccination?
So right now, it's called the ACIP group with the CDC, have just voted yesterday on their recommendations on what comes after this first batch. They have a very large group called essential workers, and within, actually they have two essential worker groups. Their recommendations are a large set that includes the professions and the occupations that you're talking about, and a lot of others, as well as Americans over 75. So they recommended two different paths at the same time. And I believe their next suggestion is going to be that states should look at some different numbers like mortality or exposure to make those decisions. We are still reviewing that information right now. There's no question, especially in the meatpacking and processing facilities, that we have seen, especially early in the virus, a significant amount of spread. And that is a place in an area, along with the others that you mentioned, where we got to make sure that the vaccine can go to those individuals, because the best place certainly for the different areas you mentioned to get vaccinated is at the place of employment. And that's something we're working to build as we go. I mean, right now we've got a trickle of vaccine, a lot of demand, and we are building up the method of being able to provide it. So for instance, right now, enrolled in the program with the federal government that you have to be enrolled in to provide the vaccine, we have 102 hospitals, 119 local health departments, 32 pharmacies. These are facilities, so a local health department can have multiple facilities. 4 regional health centers, 11 FQHCs, for a total of 268 facilities that could provide this. We're going to need more, especially when we're looking at mass vaccinations at different sites and on-site vaccinations. But we're building this airplane while we're flying it. And there is no way that it's going to go perfectly, given so much uncertainty about which vaccines will be approved, when, and how much we'll have. But I promise we'll do our very best to be transparent and also ensure that we are reaching every population out there. The push to build confidence is going to include specific outreach to Spanish-speaking communities, as well as other underserved communities that may have more hesitancy about vaccines. All right, finally, do we have Al Cross?
I'm here, Governor.
There you go. Last questions to you, Al.
Okay, Merry Christmas to you. You said
Merry
last
Christmas.
week that you wanted the first responders and K-12 educators to come next. And now that the CDC has added this age category, and you've actually mentioned the age mortality problem that we have, do you expect that in this next round you will be adding people over 75, at least to some degree, to that next group?
Yeah, we are absolutely considering that right now, because you're right. When we look at mortality statistics, it's now closer to 70% of our deaths are individuals in long-term care. And then when you go to that next biggest chunk, it's adults, well, really 60 and up, but the mortality rate 75 and up means that those who contracted at that age, I mean, face something really deadly for them. So we are actively considering that right now. We just got this information yesterday from it, but it makes a very compelling argument that getting our older Kentuckians vaccinated as quickly as possible is critically important. All right, thank you, everybody. We'll have our regular update at 4 today, but listen, this is an incredible day in Kentucky. We have all lived through very difficult 9 to 10 months. This virus has preyed on people, especially in long-term care. And today we fight back. We know there's a light at the end of the tunnel. We know that we can protect so many of those in long-term care that otherwise we might lose. Today is a great day in this battle. We just know that there's a lot more of the battle to come. So we're going to get through this. We're going to get through it together. Thank you, everybody. And thank you to CVS, Walgreens, all of our long-term care residents and workers that are working so hard. Today is another shot of hope. Thanks.